And could you tell us a little bit more about the inflatable penile surgery?
You can think it as a dental implant. So when you have a dental implant, it restores your ability of the chewing, right? It doesn't take away any of the sensations or the taste or salivation or swallowing. No, it doesn't affect any other function. Penile implant is just like that. It only restores the erectile function. Other than that, sensation, orgasm, voiding function, nothing else is changed. This is actually, penile implant model. This goes to the, penile corpora, shaft, and this one goes to the, the scrotum. So it's completely sealed from the outside. And there's a reservoir where the, normal saline is contained. So it's a hydraulic device. So if you press it, it becomes hard and erect to use. And then if you release it, it becomes a flaccid status again. So from outside the view, seldom they can tell the differences. Yeah. Actually, 80% of my patients do not tell their spouses about getting the surgery. So when they touch it, they can tell the difference when it gets erected. This one has been developed has been in the treatment for the past 47 years. So it was invented by the Penile Scott in the US. He's a great urologist. And my teacher, Dr. Wilson, started his fellowship at the second year of the second fellowship of the Penile Scott. So currently, it became the most durable and dependable implant compared to any other implant in our body. Its mechanical failure rate is the lowest, and it usually maintains about 10 to 15 years. But some patients has about more than 30 years usage. So a pretty dependable implant, and satisfaction rate is different, report is different according to the other papers, but it's between 92 to 98%. Many patients can resume their sexual intercourse after 4 to 6 weeks of the surgery. And the surgical procedure usually takes about less than an hour.
So this implant surgery is quite different from other critical surgeries like maybe prostate cancer, but it's not quite a cosmetic surgery either. How would you regard this type of surgery since you have such a rich history with it?
Actually, I was doing the cosmetic penile surgeries before I started. I was trained as a prosthetic urologist. So I have about 1,500 cases of the cosmetic phalloplasty experiences with myself. And now I have a little more than 1,000 cases of the penile implant surgery. So I think there are 3 types of medicine. The first one is a critical medicine, just like you said. It's a cancer or heart attack or stroke, something like that. It's a life or death disease, conditions, I'll say. The second one will be a cosmetic surgeries. It's like a penile augmentation or breast augmentation or nose job, something like that. We do for aesthetic purposes. Those things I think is a vanity surgery. The third one, I believe, is something like a penile implant surgery. It's a quality of life surgery. For example, for women, we have incontinence surgery, right? Or those who had a radical mastectomy, we do breast reconstruction. It could be a good example of the quality of life surgery. So this one, penile implant, comes to the quality of life surgery rather than aesthetic or rather than critical illness. So penile implant goes to quality of life surgery because this can restore man's manhood more profoundly than any other treatment you can think of.